This is Carl Shalahorn from the Debunking Addiction blog on Healthy Place. This month I'd like to talk to you about motivational interviewing. Motivational interviewing has been around for quite a while now, and it was originally designed to help people dealing with alcoholism move through various stages of change in order to abstain from their substance use. It has since been expanded to a number of different behaviors. In particular, one area that I work with in my daily job is with people with co-occurring disorders dealing with drug and alcohol addiction. Specifically, motivational interviewing has to do with moving the individual who is affected by drugs and alcohol and mental illness through different stages to help them sustain their recovery. For instance, the first of the 5 stages is the pre-contemplation stage. This is where the individual may be in denial, or they may not feel they have a problem at all. The second stage of change is the contemplation stage. This is where the individual may be ambivalent. They may be looking at the pros and cons of changing the behavior, but they may not quite be there yet. The third stage is the preparation stage. This is where the person basically is preparing to make a change. They may have a deadline in mind to start, or at least they're getting prepared to begin the process of changing that undesirable behavior. The fourth stage of change is the action stage, and the action stage is where really the rubber hits the road. This is where the individual stops using and also addresses their mental health issues. This is also where the individual may in fact do other things like attend 12-step meetings, or they may do other types of things like actively work with their counselor or therapist to stop the behavior that has been so detrimental for so long in their lives. Finally, there is the maintenance phase, and this is the maintenance stage is where basically the individual is maintaining their recovery, it's self-sustaining, and they are still continuing to do those things that help them to recover from their addiction and stop the behavior that was so damaging for so much of a time. So basically, over these 5 stages of change, what we're trying to do is help the individual move from one to the other. The clinician is especially important because essentially they're allowing the consumer, client, individual make the decision. It is the individual's decision to make the changes. They're not being forced on the person. So in respect to that, the person who is affected by their addiction and mental illness is the one in control. They're the ones who make the decision. This is a much more effective. Engagement is a big part of this process. Being able to engage the client early on in the process is very important so that they feel that they can have a trustworthy and healthy relationship with their clinician. Motivational interviewing has been found to be very effective. It is a proven, research-driven, research-based approach to treatment, and over the years it's been very positive and very helpful for many, many individuals. So if you are looking for getting help with your problem, if you have an addiction problem, or if you know someone who does, you may want to talk to your therapist about motivational interviewing. Ask them about that. Ask them if it's something that they use in their treatment of individuals, and that may be something that may help you in the process of your own recovery. So thank you for checking in for the Debunking Addiction blog on healthyplace.com. I'm Carl Shalahorn.